Hello everyone, I welcome you to today's session, and this session is on a subject which is very common. We get a lot of inquiries about this, and it's a topic called as gynecomastia. In 20% of males, the breast size enlarges during puberty, meaning after the age of 16, when there is a increase in the level of testosterone in the male body. In 20% of males, the glands inside the chest are more sensitive to this hormone, and under the influence of testosterone, there is an enlargement in the size of the chest gland. This condition is called as gynecomastia, and because it's a very common condition, affects 20% of males, it is I thought a good idea to discuss about the various treatment modalities that are available, and how the surgery for gynecomastia has evolved over the years, and how do we perform the surgery now. I am Dr. Parag Telang. I am the founder and director of Designer Bodies, our Center for Advanced Cosmetic Surgery located in Mumbai. When we talk of gynecomastia, we first have to understand that not all gynecomastia is the same. If there are 4-5 people with gynecomastia, all of them may have a different grade of gynecomastia. This grading system is important to understand because the treatment option or the surgical option varies as per the grade of gynecomastia. So when there is just a very minimal accumulation of gland in the area under the areola, it's called as a grade 1 gynecomastia. When there is a little bit of projection of the chest and there is a slight crease that starts forming under the nipple areola, it's called as a grade 2. When there is a proper crease under the breast, like how a female breast has that kind of a shape, it's called as a grade 3 gynecomastia. And a grade 4 means there is lot of tissue and there is actually a sagging in the breast as well. So the surgery is different for each of these grades of gynecomastia. I am going to explain to you how each grade can be treated and how it's possible to have a good result with a properly planned surgery. Now, to begin with, whenever a patient comes to us with complaints of enlargement of the chest, it is important to understand that not the entire enlargement that a person may see is purely made of the glandular part. Mr. Amir is asking how much does the ear job cost in dollars. Hello, Mr. Amir. I will reply to your message after I finish today's session. Wait for 10 minutes. I will message you back. So when we check a patient of gynecomastia, we feel the tissue between both the fingers, and that's how we are able to assess whether the chest has gland or fat inside it. Simran, thank you for your message, and thank you for tuning in. You're really a kind person. So on assessment of the chest area, we are able to make out how much is the gland and how much is the fat inside the chest. So these are some photos of a patient who came to me with gynecomastia. You can see that both the profiles are important. When the light of the camera is falling on his chest, you can see that there is a very good projection of the areola which is seen. And in the lateral view, you can clearly make out that this is the border of his chest muscle and the abdomen, and as compared to that, the nipple areola is quite prominent. This looks even worse when somebody wears like a round neck t-shirt, or when somebody goes for a swim. So usually children get very much affected by this condition. They develop a kind of inferiority complex when they go to the gym or when they are out for a swim. Therefore, it is important to understand that gynecomastia is a completely correctable problem, and there is no reason to fear this condition because it's completely treatable. Now, when somebody has a very minimal gland just underneath the areola, which is what I showed you in the photo before, just a little bit gland under the nipple areola. Then the treatment for this kind of grade 1 or grade 2 gynecomastia is to take a small incision at the border of the nipple, take out the entire excess gland that exists there, and put a small stitch to close it off. And that's how we can treat a small problem of a direct excision of gland. This surgery takes around 20 minutes per side, and the recovery is practically in a matter of a week or so. It's very safe. For few days there may be some numbness on the nipple areola. There may be some discomfort on moving the shoulders. When the chest muscle moves, it causes a bit of soreness, but it's a very straightforward surgery, and the recovery is normally quite smooth. Now, these are some examples of somebody having a grade 1 gynecomastia, and you can see that there is a great improvement in the contour of the chest. This particular patient used to feel very hesitant in wearing t-shirts, or he used to feel very shy, and he had become very introverted. And after the gynecomastia, his confidence was at a totally different level, and he was very confident in going to the gym. He went for his swimming sessions without any inferiority complex, and that's how this surgery can be really satisfying and transformational for the patient. Now, the second option for gynecomastia is to do a combination. So there is little bit of liposuction that is done to get rid of the excess fat. The incision itself is just a tiny puncture which is normally at the side of the chest, and purely by liposuction we are able to liquefy all the fat and gland and get rid of it. Now, when I tell my patients that we can actually get rid of the excess gynecomastia tissue by liposuction, they don't believe me. But when I show them this video, then they start understanding it better. For so many years, the only method of liposuction was the traditional method or the conventional method, where there was an incision which was required, and there was a hollow metal tube which was moved back and forth, and the fat was liquefied and removed. But now we are moving to a technology which works on ultrasonic energy, and there is a probe which is introduced under the skin. This probe has some vibrating tip at the end of it, and when this probe comes in contact with the fat and gland, the amplitude of the ultrasonic energy is such that it makes micro bubbles happen in the fat, which makes the fat cells expand, and they expand till they burst. Therefore, these fat cells are permanently destroyed, permanently lysed. Therefore, once the fat and gland has been destroyed and removed, it does not grow back. This is how we emulsify the tissues under the chest, the fat and gland both, using ultrasonic probes, and I am going to show you a small video of how we achieve this. So this is a small piece of the glandular tissue present in the chest, and you see now what happens when I touch this with the ultrasonic probe. So you can see that this is the ultrasonic probe being brought in contact with the gland, and just by the vibrations of the ultrasonic energy, this entire gland has been completely liquefied. So how a butter will melt in contact with warm knife or hot knife, similar thing happens to this glandular tissue. As soon as this glandular tissue comes in contact with the ultrasonic probe, you can hear the ultrasonic vibrations being used. It completely liquefies the gland and the fat. And therefore, even if there is a little bit of gland along with the fat, there is no need for an open surgery. And with the use of this ultrasonic energy, ultrasonic device, we can give a very good result. This is an example of a grade 3 gynecomastia, and this patient had a lot of accumulation of fat as well as gland in his chest, and you can see that at the end of 6 weeks he has a good improvement in the contour of his chest. Now remember that if this patient had opted for a surgery 20 years back, the only option he would have been offered was that of an open surgery, and he would have ended up with a big scar on his chest. But now, with the science that we have and the technologies that are available, we can easily contour these kind of gynecomastia cases without doing any open surgery by a minimally invasive technique using ultrasonic energy. You can see in the side view that the shape of the chest is excellent, the skin contraction is very good. The lot of questions center around whether the skin will sag after the procedure. Lot of patients ask me that you will remove the fat, but what will happen to the skin? Will the skin sag? The answer to this is the skin is like an elastic. It has the lot of potential for tightening on its own, and therefore after the gynecomastia surgery you are given a jacket to wear. It's like a sleeveless corset. With the compression effect of that corset, the skin really tightens up very nicely. You can see that in this particular patient the only puncture is here in the corner of the chest, and this photo is taken 1 month after the surgery. As the time passes, even this small dot or puncture is no longer visible. So a laser assisted liposuction of the chest is a very good modality for achieving a very good result for these kind of gynecomastia cases. So I have explained two different modalities for you. One was direct excision of the gland for the grade 1 and grade 2 gynecomastia, and this is ultrasound assisted liposuction, which is primarily for grade 2, grade 3 kind of gynecomastia. And now there is also a combination technique, which is the third option for gynecomastia, and this is liposuction of the fatty tissue and excision of the gland. So it's a combination of both, because in some individuals the gland is so thick that even with the use of ultrasonic energy the gland may not completely liquefy, or a portion of the gland may liquefy but some of the gland may still remain inside. And the sequence is that first we perform ultrasound assisted liposuction. This dissolves the fatty tissue in the chest area. Then we feel and check clinically if any glandular tissue can be felt when we press the chest area between two fingers. If any glandular tissue can be felt, then there is a small incision which is taken on the nipple areola, and that much glandular tissue is easily removed. Combination of liposuction has many advantages. The need for a very large incision is not there. So when we have first used liposuction to melt the fat, the residual gland is very minimal. It is not a very big piece of tissue that needs to be removed, and therefore we can remove this residual mammary gland through a very small incision in the nipple areola area. Let's take a look at an example. So this gentleman came to me with a problem of a grade 4 gynecomastia. You can see that in the photo before the surgery, his chest area is almost looking like a female area, because there is a crease under his chest and there was lot of glandular tissue under the nipple areola. So by a combination of laser assisted liposuction and glandular excision, you can see that in the after photo, which is taken 1.5 months after the procedure, he has a very good contour of the chest. Not only has the entire fat bulge been removed, but also the glandular tissue has been very well removed. If we do just a glandular excision without doing a liposuction, then he may not have had such a great result. You can see in the 2/3 view and in the lateral profile that from where he was with a proper female kind of a breast shape on his chest, he is now at a level where the chest skin has completely contracted, and the result is really very good. He is very happy, and the only puncture he has for the liposuction is hidden in the side of the chest near the armpit area. So friends, these surgeries can be performed with minimal of anesthesia. So it's a combination of local anesthesia with mild sedation. So typically the surgery takes around 20 minutes per side. So around 40-45 minutes is all that a person needs to get this surgery done. Now after the surgery has been performed, you are given a corset to wear, which is like a sleeveless jacket which looks like this. This is to be worn all the time for 6 weeks. This jacket has a zipper, and inside the zipper there are clips inside. It's important to wear the corset 24/7 because the compression effect of the garment is what ensures that the skin takes a very nice shape. We don't want the skin to sag or to become loose. Unless we give compression to the skin, it's not going to take a proper shape. So wearing a compression garment for 6 weeks is very, very important. You can of course remove it at the time of bath. Once you are done with your shower, you need to wear it again. So gynecomastia exists in different grades, from grade 1 to grade 4. Depending upon what is the grade of gynecomastia that a person has, there are very good treatment modalities which are nowadays available, which are scientific, which are based on a lot of scientific studies, and therefore the results are quite predictable, safe, and they do not cause any long-term health problems to the patient. The surgery of course will cause some amount of soreness in the chest area. There can be some numbness in the nipple areola for a couple of weeks, because if this is the skin and this is muscle, between the skin and muscle is where all the fat and the gland is. So in order to remove this fat and gland, there is like a disconnection which happens between the skin and the muscle. So till the time the skin does not reattach back to the muscle for few days or few weeks, there may be some numbness in the chest area, especially around the nipple areola, but it is nothing to worry about. One should avoid lifting heavy weights, or one should avoid doing any heavy workouts, no aggressive gymming for at least 10 days after the surgery, because the most feared complication after this surgery is accumulation of some blood, which is called as a hematoma. So it's important to give the muscle in the chest area some rest when it is healing, and therefore it is important to take at least a 8 to 10 day break from your normal gymming activities. Once the tissues have healed, you will feel a great amount of comfort when you wear different clothing, and your wardrobe will change for the better. Some areas in the chest may feel hard for a few weeks, and you are advised to massage these areas. There is something called as a lymphatic drainage massage, which is a specific type of massage which is round and circular in the chest area, that helps in draining the excess lymphatic tissue, and that's how the swelling in the chest area can also reduce faster. So a little bit of massaging is all that one needs to do if there is some hardness or if there is some pain in a particular area of the chest. Normally patients don't even need to take any painkillers 4 or 5 days after the surgery. There would be a short course of antibiotics for 4 or 5 days to take. So friends, this is a daycare surgery. You can come in the morning on the day of the surgery and go home the same day in the evening. So it does not require too much of a downtime, or it does not require too much of planning on your part. If you are office going, you can plan this surgery around a weekend, maybe on a Friday, so that Saturday, Sunday you can be resting at home, and from Monday maybe you can resume your office work. Nowadays, some professions are lucky that they have the option of working from home, and in such individuals it's even more easier to get this procedure done. So this was some information about how the surgeries for gynecomastia are performed. If you have any other questions regarding this condition or regarding the different treatment modalities that are available for this surgery, please feel free to message me, and I will be happy to get back to you with the details. For those of you who like the information that I explain, or like the way I explain things to you, please like and subscribe to our channel, Dr. Parag Telang, so that you get instant notification when we do any live sessions, or when we upload any new videos on YouTube. I thank you all for attending today's session, and I'll be back next week with another topic of interest. Till then, I wish you all a good night.